This project has been informed by a semester of research on the social movement for the decriminalization of controlled substances in the United States. The current state of U.S. drug policy remains largely unchanged from the Controlled Substances Act of 1971, which made the possession and distribution of a range of narcotics illegal and punishable by fines or imprisonment. This is a pressing issue as we are currently in the middle of a worsening opioid crisis, with the CDC estimating 109,527 people died from overdose between November 2022 and 2023. This movement also intersects with wider movements of civil rights and criminal justice reform as drug policing disproportionately harms people of color and low income communities, with FBI data indicating that while black people constitute only 13% of the US population, they amount to 24% of drug related arrests, despite equal usage of drugs and distribution of drugs between racial groups. The social movement seeks to decriminalize drugs in order to provide treatment and support for this diagnosable mental health disorder, to fight systemic racism, and to reduce the incarcerated population in this country. Zooming in on the specific goals of the movement, it is important to consider the existing public discourse surrounding drug use, which has been informed by decades of war on drugs propaganda, reaching back to the Controlled Substances Act. The current associative chain in mainstream politics and in the media is that drug use constitutes a moral failing, that drug addicts are a threat to society, and that the most effective way to address these social harms is through incarceration. However, the worsening opioid crisis and enlarging prison population in this country indicate that this approach might be ineffective at addressing the root causes of substance use disorder. Therefore, the social movement for decriminalization arose to fight for progressive drug policy, which seeks to create a new associative chain, which reframes the issue as a personal choice. It underscores the idea that substance use disorder is a diagnosable mental health condition and that the most effective solution is not incarceration, but rather through harm reduction and healthcare provision. And leaders in the social movement can include public health officials, advocates, and community organizers with lived experience. So, in order to learn more about this fledgling movement, I spoke with two prominent figures pushing for political change in their respective organizations. Firstly, I spoke with Veronica Wright, who is the founder of the National Coalition for Drug Legalization based in Maryland. Her organization is a nonprofit that seeks to educate the public about the issue of drug decriminalization through forums and research to push for political change. I asked Victoria to give some background on her organization and why she joined the movement for drug decriminalization.
This organization was started in December 2018. And I used to be someone who didn't even believe in cannabis legalization as late as 2017. But my cousin passed away. And I don't know, you probably, did you hear this story already?
No, I don't think so. And I'm
Okay,
really
so
sorry to hear about your cousin also.
oh, okay, yeah, because I didn't want to repeat it if you already knew it. Because I've been on some podcasts, but most people, haven't seen those podcasts because they're like have a very small audience.
Mhm.
But so anyways, my cousin passed away. He was someone who was born drug dependent. He went to prison for drugs and he later died an alcoholic. So at his funeral, I met his son for the first time. His
Mhm.
son is named Desmond. And I made Desmond make a promise. I said, if you graduate from college, you can come live with me, provided that you work and go to school. So Desmond kept his end of the bargain. He graduated from high school. He came to live with me, and we went through some growing pains because he grew up in an environment where, he was in foster care for a little bit, and, his dad wasn't present because Dwayne was always messed up on drugs or alcohol.
Yeah.
And so he struggled a lot in school. He stuttered really bad. And, I had to tell him things like, go to class, get a job, brush your teeth, wash your clothes,
Yeah.
let me see your grades. I was doing all these things like he was my son because I don't
Mhm.
have kids. So he was really like the son I never had. And when I went through all of that, I was like, why couldn't his dad, Dwayne, be present to see his kid graduate from high school and just take care of his kid? It's because when Dwayne went to prison for drugs, the trajectory of his life changed.
Yeah.
You don't qualify for public assistance. You don't qualify for like any type of public assistance, whether it's, welfare, housing assistance, Pell Grants at that time. You couldn't get any of that.
Yeah.
So it really, made me think about how this drug war negatively and disproportionately affects people of color, especially.
Yeah.
And it also made me think about how incarceration is not the proper public health response for drug use or drug abuse, which people kind of think they're the same.
Yeah.
So, yeah, that's how it got started.
To learn more about what Veronica and the National Coalition for Drug Legalization was doing to push for progressive drug policy, I then asked her to discuss what political strategies and tools they were using to mobilize public support.
Well, we do these public forums, and the public forums are usually made up of people who are formerly incarcerated or law enforcement or public health analysts or public policy analysts, people who are in this drug policy space.
Mm-hmm.
And, you know, they come and I ask them questions and they talk about, you know, they're like pro drug legalization. Someone else came to me and was like, maybe you should do a panel split with those who are for and those who are against. And
Yeah.
that's an intelligent way of going forward, but I'm not always, the Cato Institute, I don't know if you're familiar with the Cato Institute, but that's how they do their public forums. The naysayers are in the audience.
Yeah.
I feel like our role is to have the people who support it give, various opinions on that. And then when I do the Q&A, that the cons, the naysayers, they can come and ask their questions that way. But really the public forums, and then the other thing that I would like to do is get with the PR firm. I
Mm-hmm.
have a meeting with a PR firm, and he is actually a libertarian. And so we're gonna, hopefully he'll say yes, but I have to go and get money for him.
Yeah.
And, and hopefully he can come up with a very creative way to get people to come to the public forums and help us get money so that we can continue with this research. The research is very important. That's the other piece.
Mm-hmm.
Is we're doing research with Johns Hopkins right now. We're studying drug market violence in Baltimore. We're looking at crime data trends. Now we want to partner with University of Maryland Criminology Department to collect drug-related shootings and drug-related homicides because that was missing from the database we were using. A
Mm-hmm.
lot of law enforcement agencies across the country, they don't really collect drug-related homicides and drug-related shootings. They just collect homicides and shootings as an aggregate. And that
Yeah.
doesn't give you more defined, accurate data as to how much of the crime is attributed to drugs.
Next, I wanted to ask Veronica to explain why her organization was pushing for legalization rather than just decriminalization, given that many advocates view the latter as a more realistic political goal given this current status quo.
It's not that we don't support decriminalization. It's just that decrim doesn't do anything to protect the drug supply.
Mm.
There are no standards for purity and potency. There are no regulations in place. It just reduces the number of people that go to prison, but you can still go to prison. You
Yeah.
know, it doesn't address the drug market violence that's associated with an illicit market that comes with prohibition. So, I think that's why Oregonians had a hard time with decrim because they were expecting something from decrim that they were only going to get with full-blown legalization.
As Victoria mentioned, the drug supply would remain largely unaffected by decriminalization as it would still be illegal to sell and distribute substances in the United States. The biggest problem with the opioid epidemic is the inclusion of fentanyl in other substances, which is highly toxic in very small doses. This means that decriminalization might be less effective than legalization at reducing overdose deaths. Moreover, existing discourse around marijuana has raised the potential economic benefits of a move towards legalization, as taxation can provide revenue which can be reinvested into public health systems to better support individuals suffering from substance use disorder. Furthermore, legalization could also help erase some of the social stigma around substance use, similar to how we've seen alcohol and cigarettes become more socially acceptable since they became legal. This can encourage users to seek support from community and healthcare professionals rather than face their issues alone. However, legalization would be a larger change from the current status quo, which might be beyond the current Overton window of what is politically and socially acceptable in the United States. This is why the social movement for decriminalization has focused on that facet rather than a longer term goal of legalization. I also spoke with Dennis Baylor, who is the Overdose Prevention Program Director at Project Weber Renew based here in Rhode Island. His organization provides free harm reduction resources such as needle exchange and fentanyl testing strips to the local community. However, it also engages with the social movement for decriminalization through peer to peer education and political advocacy in the state legislature. I asked Dennis to give some background on his organization and his own role within it.
Well, of course, as you know, my name is Dennis Baylor. I'm currently the Overdose Prevention Program Director at Project Weber Renew. I'm also going to be one of the co-directors of the Overdose Prevention Center that should be opening up later this year. First and foremost, I'm a person in long-term recovery, used many substances for many years and found that my substance use, of course, really created some barriers in my life. um, the criminalization piece, that just goes back to, like you said, making a certain population of people, making it more difficult for them to achieve, to obtain some of the basic needs in life. Affects our dignity, our self-worth, our life as a whole, whether it's casual drug use or a person with substance use disorder. Of course, I've been criminally involved as a result of my drug use, not for any other types of charges, just, possession and paraphernalia, going back to the 80s. Um, and, I'm a criminal, I'm a felon as a result. Um, and in my opinion, and a lot of other people's opinions, there's no need for that. It should have been addressed, like you said, as more of a public health issue, especially these days with the fentanyl and the number of deaths that occur. Just locking somebody up, saddling them with different types of criminal backgrounds. The criminalization itself, I believe, um, also contributes to the number of deaths that occur across our country. Um, because we're criminals, we can't open up freely to family, friends, loved ones, employers.
Yeah.
Um, there's a lot of shame and guilt that prevents us from seeking help. Criminalization causes us to use in places where we wouldn't normally find ourselves. Um, we tend to rush, always on the lookout for law enforcement, and again, just making poor choices because of the potential harm that can come if we bump into law enforcement or see somebody of
Yeah.
authority. Again, shame and guilt is all a result of the criminalization that goes back from the beginning of time in substance use, practically. But then, of course, the war on drugs and crack cocaine totally changed that whole dynamic for people of color, making it even more difficult. But Project Weber Renew is a peer-led harm reduction organization. Of course, what that means basically is that most of the people who work there have lived experience that matches the people that we serve, whether it be with criminalization, uh, homelessness, uh, um, being scrutinized and punished by DCYF is a big deal.
Hmm.
Um, we have transgender individuals living with HIV, male and female sex workers. We are a microcosm of our community. And as a result, we're able to really connect and emphasize a lot of the challenges that the people that we serve have to deal with. Um, Harm reduction, of course, is all about keeping people safe, keeping them alive.
Hmm.
We don't judge them for their choices. We just try to engage, give people tools, information, resources, so that if they do want to change their life, if they do want to live in a more safe manner with their substance use, We want to provide that to them. And again, it's I've heard it referred to as non-judgmental love. That's what we try to give people, and that's every human being wants that, deserves that, and we believe that the people that we serve get much less than that, much less of that than they deserve. So we just try to keep people safe. We don't want to see people dying. That's our main goal, is to keep people alive. We've lost too many peers to accidental drug overdose, and the current policies and procedures in place are not addressing it in the proper way. That's why we're seeing the number of deaths increase each year.
Yeah.
But yeah, so that's a little background about who I am and what our organization does. About seven plus years ago, we got this idea that a safe injection site is the next step, the next viable, um, proven tool to help save lives. And being a harm organization that we are, we believe that we need to take certain risks and give that a shot. It's federally against the law. Of course, we got the state law making it legal, but we're up for the challenge.
The project that Dennis just mentioned has received national news coverage as the first state sanctioned overdose prevention center in the nation. It follows in the footsteps of similar projects in New York, Seattle, and San Francisco, but this time with city council backing and state funding. The project is set to open later this year and will be overseen by Dennis on behalf of the Project Weber Renew, and is set to reduce overdose deaths and provide valuable harm reduction resources to the Providence community. While the center shows a huge victory for the decriminalization movement, I was also interested to know more about how Weber Renew engages in wider political advocacy and pushes for policy change. I asked Dennis how his organization mobilized support from both the public and from lawmakers.
Yeah, well, again, it's advocacy is about adding a voice for people whose voices aren't normally heard. We have people in our organization and other organizations who've lived that life. They have the lived experience, and we are the best people to try to share that information with those who just are either unaware or don't care. We feel as though we need to bring it to their attention, whether it's regarding uh, funding for services, whether it's regarding the criminalization, defelonization, and um, we just believe that uh, our voices need to be heard.
Yeah.
For the most part, society, like you said, has disregarded people like myself and don't feel as though anything that we have to say carries any importance. Excuse me, trying to see what it says. Um, and we know that's not the, we don't, we know that that's not the case.
Yeah.
Those people who are dying are, mothers, fathers, children, just members of our community, black, white, of all races. Um, it's just too large of a segment of our population. We cannot be ignored. It cannot be pushed to the side. There are too many of us and too many of our family and friends and coworkers who understand that systems are set in place that don't benefit us, that work strongly against our recovery, work strongly against our ability to um, return, should we choose to normal life. We need to break down some of those barriers. And I started testifying at the state house almost from the very beginning when the organization opened up,
Yeah.
just to highlight um, the challenges. And sometimes it's just a matter of common sense. It's just a matter of common sense. And when you have the voices saying it, so some most most people will listen, will take into consideration. Just take it into consideration. Give it some thought. Look around your community. Look around the people that you know, and we all don't behave as criminals. That's not our general behavior.
Yeah,
Yeah, there's a small segment of population that uses drugs, then get involved in criminal behavior, but so is regular society,
yeah, of
from the top to the bottom, involved in criminal behavior.
course.
So you can't pile everybody into that same um, group. Um, and again, we just believe that without the voice, there won't be any change. Um, Throughout our country's history, it's the voice that matters. It's talking to the powers that be, whether they be political, whether they be the directors of healthcare organizations. You gotta make them hear your voice, um, and it has to be heard in certain places.
Yeah.
And so we're willing to go to those places. We're willing to engage with those people. Um, and for the most part, majority, which is what you need, right? Majority will listen and will take consideration and will try to make changes. But it's hard. The system's been set up this way for so many years. So it's a slow process, but so important that we need to take the time to again to raise our voices, to have those conversations with the hope that ultimately it benefits everybody.
Having learned more about each organization, I wanted to ask both of the leaders about a recent story that has centered the social movement for decriminalization in the media and public discourse. In 2021, Oregon state legislature passed ballot measure 110, which decriminalized the possession of small amounts of all drugs. Although this year, with the opioid crisis growing more severe, the state has partially rolled back the original measure and reinstated stricter criminal penalties to disincentivize drug use. Oregon's story is both a boon for the movement, as it illustrates the legislative change is possible, but also a significant challenge, as critics of decriminalization now have a recent example of how decriminalization has been tested and failed by some metrics. I asked Veronica and Dennis why they thought this policy was unsuccessful in Oregon and what the movement can learn in order to inform future advocacy efforts.
I'm an optimist. I'm an eternal optimist. So even though Oregon said no, it doesn't mean they can't say yes later. I reached out to Tara Hurst, she is the executive director of the Oregon Health Justice Recovery Alliance.
Yeah,
And this was before the legislature voted against decrim,
yeah,
ballot measure 110. And I was trying to get out there and do a public forum in support of legalization. They were like, no, that's a little bit too forward thinking right now. You know, maybe we just focus on decrim. And then they were like, no, don't come out at all because the legislature is going to vote to change this ballot measure. But one of the things that she shared with me is they did not really do. Okay, so there were two things that when ballot measure 110 got passed, a lot of the infrastructure, like the public health systems for for mental health and drug rehab, weren't in place.
yeah,
So ballot measure 110 got off to a rough start because of that. And then the other thing is they didn't really do a lot. I don't think they did a good job, or maybe, I don't know, maybe they didn't do enough to bring law enforcement into the fold
hmm,
prior to getting ballot measure 110. So what I learned from that is, if I want to gain momentum with getting public support for drug legalization, I need to build a bond with law enforcement.
yeah,
And so that's part of what I wanted Daryl to help me with is I wanted to see how we could build a relationship with the Baltimore City Police Department, start there, and just see where the middle ground was,
right,
and I think I mean, it's all about partnerships and educating people. That's why we do a lot of these public forums. So that's what I got out of Oregon. You got to educate the people because Oregon has the people that came out against it were all the red regions. So you know, Oregon is mainly Republicans, but but towards Portland
Yeah.
and there, I guess there's three major cities. I guess it was Portland, Salem, and one other city is very blue. And
Hmm.
so collectively they were able to get ballot measure 110, but everywhere else is red.
Yeah.
Yeah. So if I was, gotta build synergies there and educate people.
Well, I'm not an expert on the what's happening there. There's an organization called DPA, Drug Policy Alliance, which you're probably familiar with. They're connected to all of the states. They have legal advisors and other people involved in other states. So I'm on a lot of calls with them.
Hmm.
But and again, I can't quote as if I know everything about what's going on in Oregon because I'm
Yeah.
focused on Rhode Island. But we do hear things, and other people in our organization may be more keyed in. But I think it's one thing to decriminalize the usage, but until you can provide those supporting services, starting with housing,
Hmm.
and then you know treatment beds and detox beds, and um, getting law enforcement to change their behaviors around it. You need the entire infrastructure to be ready um, for that change. I don't know if that was necessarily the case in Oregon, because housing is such a big issue. Housing is what really drives the public usage.
Yeah.
Housing is what drives the people hanging out in certain areas. Generally speaking, because they don't have someplace safe to go to, someplace where they won't lose their apartment or they won't lose their job, and so yeah, we hang out. We hang out, and everything is in the public, and so again, those supporting structures need to be in place to accommodate the individuals who now don't have a fear of incarceration or the fear of immediate incarceration, but still don't have any place to go.
Yeah.
So
Right.
still don't have any place safe I can use that. I can't, because of my family or my loved ones or something I can't go use there. So again, it's a challenge, but it comes down to, I believe, structures in place to support um, how things will change when substance use is decriminalized.
Hmm.
Even having a number of overdose prevention centers or places where people can go in and just use comfortably. Will stop some of that public usage. You put it in the right places. And as somebody with substance use disorder who used drugs for a lot of years, I would much rather use indoors.
Yeah.
I would much rather use in private, semi-private environment. Um, so yes, structures need to be put in place, and I'm not sure if what Oregon's preparation was for that. But again, it's the opposite of just locking people up, the opposite of compounding challenges with criminal records and so on. Uh, the opposite has to be tried in order to see some change. Again, you can't keep doing the same thing over and over again, expecting different results. We see the results. The results are more deaths. So try something different, and even if it's not successful initially, you keep trying.
Yeah.
I know that there's a bill currently at our state house. Of course, we did a good job with, first of all, defelonization. was a nice step, but yeah, decriminalization of certain uh, quantities of possession just makes sense. Again, yeah, outcomes I think will be better for the individuals. I saw a statistic that says when somebody gets locked up, they're 24 times more likely, 24 times more likely to overdose once they're released than the general public or whatever. So, even that again contributes to the overdose deaths.
Speaking with these leaders in the social movement for drug decriminalization provided real insight about the inner workings of advocacy organizations such as the National Coalition for Drug Legalization and Web of Renew, as well as the movement at large. A couple common threads emerged in their reflections. Firstly, both Dennis and Veronica underlined that lived experience can be instrumental in framing the issue with compassion, and this can come either from people with friends or family suffering from substance use disorder, or from residents in communities with prominent drug problems. Emphasizing empathy rather than judgment is the first step towards progressive drug policy centered in a public health approach. Both organizations also center their advocacy in education and mobilizing support on different levels, ranging from peer to peer interaction to community based forums, and all the way to political lobbying and dialogue directly with lawmakers. As the movement is still in its early days, coalition building is vital to provide enough momentum and public support to apply effective political pressure. However, despite the success of organizations such as the National Coalition for Drug Legalization and Weber Renew at shifting public opinion on a local level, the existing and dominant associative chain is informed by war on drug propaganda, which paints users as criminals, deviants, and causers of social harm rather than sufferers of it. So, in order to face the pressing issues of the opioid crisis and systemic racism within the criminal justice system and throughout society at large, it is therefore important to center voices with lived experience, inform policy with empirical research which overwhelmingly supports decriminalization over incarceration, and provide other forms of social care in tandem with harm reduction resources, which include housing and healthcare, which aim to address the root causes of substance use disorder. Therefore, in order to achieve success, the social movement for decriminalization must create a new associative chain in its educational and advocacy efforts. Firstly, we must remember that all human beings deserve empathy and dignity, which is not only enshrined in the Universal Declaration of Human Rights, but also in basic human decency. From this baseline, it is easy to see that substance use disorder is a mental health condition similar to anxiety or depression, which requires medical treatment. Incarceration does little to address the root causes of substance use disorder. Furthermore, aggressive drug policing, especially in communities of color, only exacerbates existing social harms that contribute to drug use, and under current policies, individuals released from the criminal justice system are offered little to no assistance to recover and find support. Therefore, drugs must be decriminalized and more resources must be invested in harm reduction and healthcare provision rather than law enforcement. This also includes more general social programs such as housing or education, which reduce the risk of substance use disorder. By formalizing and distributing this associative chain, the movement can shift public opinion and pressure lawmakers from the bottom up. However, in order to build political power, we must educate our peers, support harm reduction and public healthcare resources through donations or through the ballot box, and pressure our representatives on a local, federal, and state level to uptake the issue. The opioid crisis is not an existential threat. It is a social problem caused by decades of neglect and criminalization of drug users, which have subjugated and repressed this vulnerable group without providing them compassion or support to promote their recovery. A better future is possible thanks to organizations such as the National Coalition for Drug Legalization and Web of Renew, but they need our help.